welcome back. October is National Depression and OCD Awareness Month, and joining us now from our sponsors at UBMD Primary Care to help us recognize the impact of these conditions is licensed social worker Shirley Mazurek. Thank you so much for coming in today.
Thank you so much for having us.
Of course, this is important topics that we're talking about, so I would love it if you could start off by breaking down and explaining what exactly is depression and then OCD.
Yeah, great question. So major depression is a period lasting at least 2 weeks. For many people, it's longer, of persistent low mood, loss of pleasure in activities, loss of enjoyment in life generally. And we know that there can also be some associated symptoms with disturbance of sleep, energy, concentration, things like that. And with OCD, basically that is intrusive thoughts, images, thoughts that are distressing, that a person can't get out of their mind. And then there's usually a corresponding behavioral or mental compulsion that a person suffering with OCD engages in to try to diminish some of their suffering.
Okay. How common is depression, and then on the other side, OCD as well?
I'm so glad you're bringing that to the conversation because it's more common than sometimes we realize. The National Institute of Health, for example, estimates that at least 5.7% of all adults in the country, that's representing almost 15 million people, will experience an episode of major depression at some point in their lifetime. And with OCD, that's a little bit less, but it is still 2.3% of our population. So if you think about it day to day, that's about 1 in 40 people that you might encounter could be experiencing some form of obsessive compulsive disorder.
Okay. Let's talk about the treatments for depression, anxiety, and OCD.
Yes, so first line of defense for all of these mental health concerns really is counseling, learning to know what to expect, learning how to maybe restructure how we're thinking about and approaching some situations that we're impacted by, and also growing some tolerance, some coping skills for really being able to cope with distressing symptoms.
And, you know, we were talking about this during the commercial break. I was asking about kind of the stigma when it comes to medication for anything, whether it's depression, anxiety, or something like OCD or ADHD, whatever it may be. There's something that kind of holds people back because of side effects and again, really what people might think about it. So where, in your professional opinion, is the right time to look at that as an option for treatment?
Thank you so much. That's such an important piece to bring to this conversation, that there is still stigma. But more and more, we really want to normalize that talking about behavioral health topics is just as important as talking about physical health care. And any time is the right time, but I'd especially recommend asking for professional help, whether from a counselor, a psychiatrist, a primary care physician, when you notice that some of your symptoms might be impacting your ability to function in some important areas, maybe relationships, ability to concentrate at work, and especially if you're having any really concerning thoughts like wanting to harm yourself or someone else.
So those are the instances where that's kind of the warning sign that that's when you should start seeking professional help.
Definitely, yes. And you know, your physician in your primary care office or a specialty care office can really be your ally in figuring that out.
What about loved ones or family members supporting someone that they think or can tell is suffering from things like depression or OCD? When's the right time for them to step in?
At any point that they notice their loved one is suffering would be the right time to start talking about it, either directly with their loved one or in conjunction with their healthcare team. We know that moral support and encouragement to participate in treatment really helps patients to be able to recover sooner.
That's right. I know we brought you on as our sponsors with UBMD Primary Care as kind of a resource for our viewers. So where can they go to get more information or find a provider for them?
Yeah, so first line of defense is always their primary care physician. At UBMD, we have several primary care offices, but also there are specialty care offices like UBMD Psychiatry and some of our community partners that have specialty clinics throughout Western New York.
Alrighty, well, thank you so much for coming in and talking about this important topic. We know how common it is and how many people are affected by both of these, disorders, I guess is the right word to say. And knowing that they're not alone and there's help out there is important. So thank you so much for coming in, Shirley.
Thank you so much for having us.
Viewers, if you or your loved one is in need of resources for recognizing or treating OCD or depression, you can connect with our sponsors by visiting ubmdprimarycare.com. Thanks again for coming in.
Thank you.